Hello everyone, this is Dr. Zenelji and welcome back to Script Ed. In today's episode, we're diving deep into one of the most talked about and hard to find medications on the market. It's a drug that's emptied shelves, strained the supply chain, and left patients in a nationwide waitlist. That's right, today we're talking about Ozempic. So what exactly is Ozempic and why has it sparked so much attention, not just in diabetes care, but across weight loss clinics and social media feeds? Well, let's break it down. What is it? How does it work? And why everyone from endocrinologists to TikTok influencers seem to be talking about this? Semaglutide is part of a class of medications known as a GLP-1 receptor agonist. We'll unpack exactly what that means here in a bit, but what's important to know up front is that it's the active ingredient behind two major brand names that you've probably heard of. That's going to be Ozempic and Wegovy. These two products use the same core molecule, but are just marketed a bit differently for different purposes. So Ozempic was initially studied and approved by the FDA for type 2 diabetes. It's used alongside diet and exercise as an adjunct to help lower blood sugar, especially in patients who have not reached their goal on metformin or other oral agents. In clinical trials, especially in the SUSTAIN trial, it outperformed older options like Januvia and Byetta, and even baseline insulin, like insulin glargine, with an average A1C reduction of about 1.5 to 1.8%, which is fairly significant. Then you have Wegovy, which is a semaglutide at higher doses, and it's approved for chronic weight management, both in adults and also in teens 12 years and older, who are either obese or who are overweight and have other comorbidities, things like hypertension or dyslipidemia. Now, the weight loss data is pretty striking, actually. So again, in the STEP trials, patients lost about 15% of their body weight over a period of about 16 months, compared to just over 2% in the placebo group. And beyond diabetes and weight loss, semaglutide is also pulling weight in the cardiovascular space. In the SUSTAIN and SELECT trials, it showed reduced rates of major cardiovascular events. So that's things like stroke and heart attack and other cardiovascular-related deaths, particularly in patients who have type 2 diabetes and existing heart disease. There's even growing use for kidney protection in people with diabetes and chronic kidney disease with this medication. In terms of formulation, semaglutide is primarily given as a weekly injection. Ozempic comes in doses ranging from about 0.25 milligrams up to 2 milligrams, while Wegovy ramps it up to about 2.4 milligrams once weekly. There's also an oral version actually called Rybelsus, which was the first oral GLP-1 agonist available in a tablet form, though it has much stricter dosing instructions that isn't approved for weight loss. To understand how semaglutide works, let's first take a step back and talk about what the body naturally does with GLP-1. GLP-1, or glucagon-like peptide 1, is an incretin hormone. It's basically, it's a peptide or a chain of amino acids, a string of amino acids that's put together. It's derived in the gut and it's released after eating, mainly in response to carbs and fats. It's secreted by these specialized cells in the gut called enteroendocrine L cells, which is located in the distal ileum and the colon as well. Interestingly enough, it actually gets released within minutes after having a meal. So even before the meal even reaches the gut, right, or that portion of the gut. This early release happens thanks to a neuroendocrine signaling and nutrient sensing in the upper tract, GI tract, kind of like a cephalic reflex phase, preparing the body for the incoming fuel. So once released, glucagon-like peptide 1 or GLP-1 has a couple key roles. So number one, it stimulates insulin secretion. But the important thing about this is that this only happens when there's elevated glucose levels. So it's a glucose-dependent mechanism which reduces the risk of hypoglycemia, which means that when glucose levels are low, you're not gonna have the insulin release. It also suppresses glucagon secretion from the alpha cells in the pancreas, which prevents the liver from pumping out more glucose. In the stomach, it slows gastric emptying, so it slows the transit time, the amount of time that it takes for food to get from the stomach to the small intestine, which helps flatten the post-meal glucose spike. Additionally, in the brain, particularly in the hypothalamus, it increases satiety. This happens through a direct vagal nerve signaling, so through a direct nerve from the GI tract up into the brainstem and then into the hypothalamus. The problem with native GLP-1 agonists is that it gets broken down almost instantly. There's an enzyme called dipeptidyl peptidase 4, or DPP4, which cleaves a specific bond on the GLP-1 within minutes of it being released. That's why the natural hormone, or that natural peptide that our body produces, we can't really use as a drug because it only has a half-life of about 1 to 2 minutes. So it's not long enough for it to be therapeutic. So this is where semaglutide comes in, which is a synthetic analog of the GLP-1 that has been structurally modified to last much longer and to resist degradation from that enzyme in the gut, the DPP4. So it includes 3 major changes that are important for this discussion. First, it happens at position 8, which swaps out alanine for an unnatural amino acid called AIB, which blocks actually the enzyme DPP4 from cleaving that specific site. Secondly, it modifies at position 34 and avoids unwanted chemical modification. And thirdly, it adds C18 fatty acid chain at the position 26, linked by flexible spacer. So this promotes albumin binding, which protects the molecule from renal clearance, which means that it's binding to proteins in the serum or the blood, and which will prevent it from being filtered by the kidneys and broken down, aka it will last longer in the body. So what's the result of all this? Semaglutide resists breakdown, it circulates longer, and it provides stable, continuous GLP-1 receptor activation. It's got a much longer half-life than its native counterpart, roughly about 160 hours, which is why we do once-weekly dosing. And functionally, it delivers more consistent metabolic effects. It has better glycemic control, it has sustained appetite suppression, and it's clinically meaningful weight loss, and with less fluctuation than the older, shorter-acting GLP-1 agonist. In short, semaglutide is a cleverly engineered GLP-1 mimetic, right, that overcomes the limitations of the natural native GLP-1 that our body produces. And that's exactly why it has become such a powerful tool in both diabetes and obesity treatment. So like any medication, semaglutide does come with side effects. It's important to be aware of these types of side effects that you may experience in this treatment. So let's break this down into common side effects and then maybe some more serious side effects. Firstly, let's talk about the common side effects. So most common side effects are going to be GI related, right? So you may have nausea, vomiting, diarrhea, stomach pain is a common one. But again, it tends to go away after the initial titration. Some patients do experience decreased appetite as well, particularly on the higher doses with Wegovy. Now, while these GI side effects are relatively common, they're typically temporary, usually during the titration phase. But there are also more serious side effects that you should be aware of, and that also comes with black box warnings. So pancreatitis, which is inflammation of the pancreas. This is a serious concern. So if you have any history of pancreatitis in your family, this is not a medication that you want to use. Number 2, and probably the most important one, thyroid cancer risk. There's potential that links medullary thyroid carcinoma, or MTC, and multiple endocrine neoplasia type 2, or MEN2, which are rare but serious conditions. Patients with a family history should generally avoid semaglutide. All right, before we wrap this up, I want to go over a few key counseling points and things that you should be aware of. These are things to keep in mind, both from a safety and effectiveness perspective. Number 1, let's first talk about the titration. You want to start low and then go slow. So ideally, you would want to start on the 0.25 milligram dose, and then you slowly work your way up to the 0.5 milligrams, and then 1 milligram, and then 2 milligrams. Now keep in mind, when you start on the 0.25 milligrams, you don't want to do it more than 4 weeks because it's not a therapeutic dose. You're not going to see a drop in your A1C. The idea behind the 0.25 milligrams is just to get your body used to the medication and to decrease the risk of GI effects. Number 2, timing and administration. So like I mentioned before, semaglutide is a once weekly injectable medication, which is the best part about it. You can inject any time of the day. You can do it with or without food. It really does not make a difference. The key is to do it on the same day of the week. Now, if you miss a dose, you have up to 5 days to take that missed dose. But keep in mind, after about a week or so of a missed dose, you really don't want to continue in that therapy, especially if you're in the higher doses. You may have to go back down. You may have to even restart your titration. That's something to consult your healthcare provider about. Another key point is to monitor for pancreatitis symptoms, so inflammation of the pancreas. So things to watch out for is going to be severe abdominal pain, especially if it's radiating in the back. You want to discontinue the medication and talk to your provider right away. And then number 4, let's not forget about the black box warnings. So specifically the thyroid cancer. Semaglutide should not be used in individuals who have either a personal or family history of any sort of thyroid cancers. That's just the easiest way to do it, just avoid the medication. Now moving on to long-term benefits. Keep in mind, the A1C reduction and the weight loss is not going to be instant. It's going to be gradual, potentially around 8 to 12 weeks is your timeline. That wraps up today's video on semaglutide. Thank you for joining me on this deep dive into one of the most impactful medications out there for diabetes and weight loss. If you found this information helpful, please like, subscribe, and hit the notification bell. Until next time, this is Dr. Zenelji with Script Ed. See you soon.